So this is a 70-year-old lady with newly diagnosed renal cell carcinoma who presented to her local physician with abdominal discomfort and weight loss. And she was evaluated and found to have a large mass in her left kidney. And she had a solitary lesion in the liver that was consistent with liver metastasis. At that point, she was referred to a local urologist who proceeded and performed a left radical nephrectomy. And in the setting, during the operation, they confirmed the presence of a metastatic lesion in the liver, which was solitary, and they wedged it out. So after she recovered from surgery, she had rescans 6 weeks later, and unfortunately, she was found to have multiple liver lesions in on the scan. And that's when she was referred to a medical oncologist in the community who started her on sunitinib at the dose of 50 milligram daily, and they chose the standard schedule of 4 weeks on, 2 weeks off. So she tolerated this reasonably well initially. However, she developed some fatigue, diarrhea, and hand-foot skin reaction. And at that point, the local medical oncologist decided to interrupt therapy for a few days and then reduce the dose to 37.5 milligram daily and maintain that schedule of 4 weeks on, 2 weeks off. She had an initial response, but 4.5 months later, unfortunately, she had some fatigue and abdominal discomfort again, and was noted to have progression of her liver metastasis. At that point, the local medical oncologist decided to treat her with nivolumab. And she received nivolumab at the 3 milligram per kilogram dose every 2 weeks. She felt better, and scans 8 weeks later showed a response in the liver. And she was maintained on nivolumab and tolerated it reasonably well without major adverse events until about 8 months after initiation of nivolumab therapy. And that's when she started having fatigue again, and abdominal discomfort and weight loss. And that's when scans showed progression of liver metastasis. In addition, she had back pain, and evaluation at that time showed, by MRI of the spine, showed metastatic lesions in thoracic and lumbar vertebrae. At that point, she elected to come to MD Anderson for a second opinion and a discussion of treatment options. And that's when we chose to start her on cabozantinib, 60 milligram a day. And she felt better within 4 weeks of initiation of cabozantinib. And she was maintained on it until she had reevaluation with scans and MRI of the spine 8 weeks after initiation of cabozantinib at 60 milligram a day. And that's when she was found to have response with improvement of the spine metastases and liver metastasis. So she was maintained on cabozantinib for approximately 4 months, but then began to have more fatigue and some diarrhea and hand-foot skin reaction, as she had previously with sunitinib. And we made the decision to reduce the dose down to 40 milligram daily. And she maintained cabozantinib at 40 milligram daily for approximately 13 months. And at that point, she had progressive disease again. So that's basically a summary of the case of the 70-year-old lady. There are options as fourth-line therapy, and of course, participation in clinical trials would be a consideration as well at MD Anderson.